Back now with the latest on the prostate cancer diagnosis for former President Biden. Biden posting this photo on social media saying, "Cancer touches us all. Like so many of you, Jill and I have learned that we are strongest in the broken places." Our medical correspondent, Dr. Darien Sutton, is here with us. And the former president's office has released some of the details about his diagnosis. Break this down for us.
Yeah, so just to get a better understanding, because there's so many terms and words that are used in this diagnosis, and it's so common, but very few understand the details about it. So what we know so far is that the former president, presented with a prostate nodule due to urinary symptoms. And that likely led to a full workup and a screening that included a biopsy to understand if that nodule was harmful. And unfortunately, the diagnosis of prostate cancer was made. Now, with that diagnosis, the pathologist, the provider, the physician who looks at those cancer cells under a microscope, then helps us to understand how abnormal those cells are, and that creates a score called a Gleason score. It's important to know that a Gleason score of 8 to 10 usually indicates that those cells are very aggressive, very abnormal, and more likely to spread. And the former president, received a Gleason score of 9.
That's not good there. So the cancer also appears to be hormone sensitive. What is that, and what are possible treatments?
Yeah, so important questions here. So that's the next part of this workup, this understanding of the type of cancer. What's important to understand is that hormones like testosterone drive the growth of normal prostate cancer or normal prostate cells as well as cancer cells. And certain types of prostate cancers, not all, will respond to hormone treatment. So what we understand is that the president has hormone responsive cancer, which then means that he has another opportunity for treatment. Medications that can block those hormones and prevent the spread of that cancer as well as the recurrence of cancer.
And this type of cancer is common in men of the former president's age, right?
Yes, it's very common. Nearly 3 million men are living with this condition every day, and it's important to understand that living with this condition means very different. The picture of this diagnosis looks very different than it did 30 years ago, thanks to advancements in screening, early detection, more treatments. The rate of death from this diagnosis has decreased by more than 50%. So it's another reminder to start these conversations early. The recommendations generally by the United States Preventative Service Task Force, that task force that creates guidelines for us to help patients guide them through their screening, recommends that you start this conversation at 55. As a physician, I recommend starting that conversation earlier, in your 40s, especially if you have a higher risk. If you have family members with this diagnosis, for Black men, we're at a higher risk of this diagnosis, so we have to start these conversations early. And again, remembering that there are treatments out there, and early detection most often always brings you better outcomes.
And what about survival rate? I mean, can you live, 5, 10 years after?
Absolutely. The rate of survival is incredibly high, especially when this is found early. Now, with risk factors like age, the former president is 82 years old. In terms that is one of his significant risk factors here. That can decrease your outcome. But again, with additional treatments, with the early screening, with the advancements in the way that we do things, there are really, really wonderful outcomes that can happen after this diagnosis. And it's important to keep that hope alive. And of course, I wish him the most strength and peace and also patience during this diagnosis.
And hopefully the silver lining is everybody gets a little awareness as well.
Absolutely.
Thank you, Dr. Sutton. We really appreciate you. Yeah.